If you want to lose all of your gains and the progress that you've made in your respective sport, then the answer is simple. Get a shoulder injury and don't invest time into exercises that enable the joint to work effectively. If you want to know some quick solutions to instantly ease your shoulder pain, but also want to hugely prevent the onset of shoulder pain in the future, then keep watching. I've handpicked 4 of the easiest and most effective techniques that my clients have excelled with. But first, let's look at the anatomy. So you've got the supraspinatus that runs along the top of the joint. You've got the infraspinatus and teres minor that run along the back of the joint. And then you've got the subscapularis that runs on top of the shoulder blade and into the arm along the front. Essentially, it's like squeezing a balloon. If these muscles are really tight, then it's just going to push the head of the arm slightly further forward. And what this does is pushes that out of place. So then if it's further forward and you're reaching up, you're doing overhead press, for example, it's just going to impinge and pinch on the structures and the joint's not in a biomechanical advantage. So you want to make sure that these muscles are really nice and loose, nice and mobile, and you're able to go about your day-to-day activities without any impingement and pain. Within this video, I'm going to share with you my top 4 soft tissue release techniques for the rotator cuff. So what exactly is a soft tissue release technique? Well, if you look at the structure of the muscle, you've got loads of fine bands that become tight if the muscle isn't recruited enough, or if it's weak as a result of pain. These tight areas can compress nerves to cause direct pain, or cause slight malalignment in the joint to cause indirect pain. In order to release these tight bands of muscle, we apply an external stimulus such as a ball onto the muscle, take relaxing breaths and move to alter the stimulus to the brain and restore the balance of the joint. The first release technique will focus on the subscapularis muscle, which is the largest of the 4 rotator cuff muscles that wrap around the shoulder joint. Its primary movement is internal rotation, i.e. rotating the arm down and in towards the body. To effectively release this muscle, grab a mop or a broom, place it in the centre of the armpit, move it in and down by 2 inches and just slowly rotate the arm until the discomfort eases. If tight and not released, the subscapularis can cause a whole host of issues, including referred pain to the upper body, a real weakness in the shoulder, a sharp pain located at the front of the shoulder, and it can also really restrict the amount of movement that you've got available at the shoulder joint. And this is something that we'll look at further. If weak and tight, the main movement that the subscapularis restricts is external rotation, demonstrated by the figure below. This is beautifully demonstrated in a study by Dontelli in 2018. So essentially, if the subscapularis is tight, then it really restricts the amount of external rotation that you've got. So how does this affect my shoulder? The study went on to conclude that external rotation is vital for pain-free movement of the shoulder, and essentially if it's restricted, then it can be a precursor for not only impingement but also rotator cuff tears. This technique is for the posterior cuff, aka the back of the shoulder. To get it started, you just want to place a spiky ball up against the wall and just lean into it until you start to feel pressure. You then want to gently massage by circulating your shoulder round and lean into it more in order to increase the pressure that you're placing on it. This targets the infraspinatus and teres minor, which are both components of the rotator cuff. As soon as you find a tight band of muscle or it feels particularly tense, just hold your position and take nice deep relaxing breaths in order to reduce the tension in the muscle. Once it's no longer sore with massaging, you can easily progress by lifting up the elbow and rotating the arm up and down. A 2020 study by Kevin Hall explored the impact of this technique on internal rotation, which is the movement that I'm demonstrating here on the left. And he reasoned that a loss of this movement can lead to impingement and pain in the shoulder. More interestingly, he found a staggering immediate improvement of 10 degrees between the pre-release and the post-release group. This technique utilises a foam roller in order to reduce the muscular tension in the posterior cuff. Place the foam roller directly under the armpit and gently increase the pressure by straightening the arm. Use a gentle rotation to massage the rotator cuff at the back of the shoulder until the pain begins to ease. Any flicking sensation is completely normal and just demonstrates how tight the bands of muscles are in your rotator cuff. As soon as you find a particularly tight area, you just want to pause and focus on your breathing, taking 10 really nice deep belly breaths. And what this does is reduce the amount of tension within the nervous system and just helps the muscle to relax just that little bit quicker and more effectively. This final technique is a static stretch for the posterior rotator cuff muscles and also the joint capsule. You want to lie in a fetal position and leverage your body over the arm until you feel a really deep stretch. And instead of counting, you want to focus on your breathing, so take 10 really nice deep breaths until you feel the muscle starting to relax. So it's really important that you listen to your body. A thesis by Ferrell was recently conducted to compare static stretching to myofascial release, and it actually found that both in combination was by far the most effective approach to improving internal rotation, which we know hugely reduces the likelihood of shoulder pain, impingement and other shoulder pathologies. So it's well worth doing all of these exercises in combination. Thanks for watching this video, and I hope that these release techniques are really helpful for you. If you've got any queries or questions, drop me a comment in the section down below and I'll be more than happy to help out. But here's what you want to do next. So I've got a video on rotator cuff strength. So essentially the muscles are weak, then they're going to get really tight to compensate. So you really want to build them up by watching this video. Additionally, there's a more comprehensive plan on my shoulder instability program as well. So if you watch both of those videos and combine it with these release techniques, then you've got all bases covered. I'll catch you in the next video.